There we go. Brilliant. So, yeah, really excited to be here and a great opportunity actually to talk about Start Well, End Well with you all. So, my name is Vardeep Diogan. I am also a Q member. So, I do echo everything that Julia was saying about being part of that community. I work in Bristol, so I live in Bristol and I work in Bristol at North Bristol NHS Trust. I entered the NHS as a diagnostic radiographer, and I still am a radiographer. I keep my registration, but probably like many of you, I've had a bit of a squiggly career within the NHS, and I'm really grateful for that actually. Although sometimes that also can be challenging in itself. I'm a senior continuous improvement manager. I've been working in quality improvement for nearly 8 years. Within that time, I've qualified as a coach, so I do a lot of one-to-one and group coaching. I'm also a Schwartz facilitator, which I'm so passionate about. And in fact, after this presentation today, this afternoon, I am facilitating a Schwartz round in my hospital. And I think one thing that connects a lot of what I do together, all together, is the supporting and working with teams, which is where I think Start Well, End Well really fits in, because it is all about that. It is all about sort of that team connection. And so if I just move on to the next slide, just bear with me. There we go. So as an overview, and you would have read this in when you were signing up for this presentation, Start Well, End Well is a framework, and it is about fostering that team connection, compassion, and working together. And I will shortly be going into a little bit more detail about what these steps are, and then sort of obviously elaborating sort of further still on that. But I just wanted to sort of set the scene really as to why this even came about. And, you know, I don't think I need to remind you, any of you, if we were to rewind back to 2020, of what was happening due to the COVID-19 pandemic. And in fact, some of you might have even been watching the new ITV drama series called Breathtaking, which I think is about this. I haven't seen that yet, but I've heard lots of things about it. But if we were just to sort of take ourselves back there just for a moment, there was an awful lot going on. But one of the things that we noticed in our hospital, and this may be shared with you all as well, is that as we were sort of being moved around, working in areas different to our normal areas of working with people that we might not have worked with before, that constant uncertainty, that constant change, both within our organisation, but also just generally globally, as to, you know, what COVID was all about. I think one of the things that we really heard and sort of really came out is that the stress that this was causing individuals who were working in healthcare, you know, that whole sort of scenario and context, the level of stress that was, you know, drawing out in people, and this wasn't just one or two people saying that. It was sort of being heard quite a lot, and it was worrying actually. It was quite alarming. It's not probably something that we'd experienced like this together. And this led to our staff psychology team, our clinicians that were working on the front line, and that's how I got involved sort of from the quality improvement aspect, is actually what can we do about this to support people in the moment when this is sort of unraveling as we're going along, to help people to sort of stay connected, because it was scary times, wasn't it? So it really sort of came and was born from that, really, that sort of situation that we were experiencing. And we weren't alone actually with asking that question, because Michael West, who some of you, possibly all of you, will have heard of, was also asking the question of how do we create effective team working under pressure quickly and build trust. So, you know, the same question was being sort of asked at a national level, and it was the same question that we were sort of asking ourselves internally in our sort of local context. And he had sort of drew upon these sort of, I think there's 12 points here of what was needed in this situation, what was sort of core, what was really, really important. And I've categorized them in those three categories actually of things to me that appeared like actions. So in those sort of moments, making it really clear what the team purpose is, what, and that purpose could just very be in that moment. What is our purpose today? What is our purpose now, rather than the wider sort of philosophical question, why are we here? It's more like what is our purpose right now? What are our objectives? Who's doing what? So that clarity of roles, and not just to focus that on an individual level, but from a team level. What skills do we have? Because one of the frightening things I think people were experiencing, if you worked just for example, perhaps you were a neurosurgeon, um, um, and that was your place of work, and you were obviously moved elsewhere and maybe in the emergency department, your competencies are going to be very different, and people might think, well, you're a doctor, you can do this, you should know what you're doing. Actually, that's quite scary, because the situation for them would have been totally different. You've become an expert in one area and you're being moved somewhere else in an emergency sort of area. So being able to talk about what the competencies are at a team level, and being able to speak up, and share any concerns, was really, really fundamental in this sort of frightening time, really, and pressured time. And part of what Michael West was also saying is that, as well as those actions related to clarity, there's also habits and behaviours that we need to sort of develop and build upon and maintain. Things like providing regular feedback, developing shared responsibility. So that's a really different type of leadership, I think, that we're used to in the NHS. Shared or distributed leadership and responsibility is something, that we could probably afford to do more of. Regularly plan and review and value everyone's contribution. So that was sort of a key thing there. And then he describes what I would describe as the principles behind this, of encouraging a climate of compassion, minimizing hierarchy where possible, the importance of trust. And actually, in this, I suppose, in this particular scenario, competition is disastrous. So not sort of elevating that competition aspect of it, because the whole purpose behind this, in this context, was to create sort of team connection, and to sort of feel that we were in this together and we were moving forwards in this together, so that nobody sort of was left worrying and feeling scared, or unable. And sort of in hindsight now, when I look at all of this, and that's one of the great things of being able to sort of speak about it, still, 4 years later, is that some of these things we know already to be true. And it takes me back to, some of you might be familiar with the research that Google did, so the Aristotle sort of project, of what was important. So they looked at 180 teams to really understand what made them effective. And they came up with 5 key sort of things in effective teams. The first was psychological safety. So that definitely is what this slide sort of has, and the Start Well, End Well framework has weaved throughout it, is the element of psychological safety. Dependability was also important in that piece of research. Structure and clarity, and again, when we look at this slide, that the importance of having structure in terms of who's doing what, and clarity over who's doing what, really, really important. Meaning, having meaning in what you do goes back to a purpose. So making clear the team purpose, again, that just reinforces why what was shared here. There's evidence that supports it. And knowing your impact was the 5th sort of finding from that Google Aristotle project. So I guess, why am I sharing this? It's to say that these things aren't just nice to do when we're having a really good day, and they're not just, you know, words on a page. There's plenty of evidence, and it's evolving constantly, that these things here that Michael West was talking about, and a lot of pretty much all of what Start Well End Well is built upon, is evidence-based, and what we know to be important when it comes to working together as teams. By the way, I was going to say, I forgot to say at the beginning, that we will be sharing a PDF of all these slides. So, you know, please don't worry about that. And also that I am going to make time for questions at the end. So if you do have questions that are popping up in your mind as you come along, as we're going along, please do write them down, pop them in the chat box if you wish. But I'd love you to be able to ask those, and we have a bit of a discussion at the end. Now, I'm just going to very briefly go through the three sort of steps as we design them in Start Well End Well at that time. So, you know, this was back in 2020. We've tweaked it sort of since. But my main message here is, even though I'm showing you what it looks like, the invitation is that if you did want to use this in areas of your work, the invitation is to adapt it to how you need it. So I think it's quite clear from how, you know, what I'm sharing, that we did come upon this or design this from a clinical perspective, but this can be used and adapted and changed, you know, however you work, wherever you work. You may be non-clinical, but the point is that you're working in a team, and the size of that team, you know, could be 5 of you, or it could be hundreds of you. It can be adapted to your needs. So that actually is one of my main messages to you as you look at this, and sort of the takeaway message as well. But I wanted to show you what we created, so you can then think about how you might adapt it as well. So considering at that time safety was, you know, patient safety, but safety generally was really, really important. You know, our check-in was very much that ABCDEF approach. It just allowed for structure and clarity, and it fitted in really well with the safety sort of aspects of it. So B, C, D, and E are all about, pretty much all about, you know, the safety things. You know, we've got written on there PPE availability. That was a real question that we were asking ourselves at that time. Do we have enough masks? Do we have this? Do we have that? That probably and isn't relevant so much today. You know, there were lots of changes and difficulties that were being faced, so that's why it was important to have that on our check-in at that time. But also there's other really important things here that sometimes we take for granted, and that's arriving well and constantly giving people the opportunity to speak up and to say that. And to say how they're feeling, rather than sort of starting, is everyone okay today? And then people feeling like they can't say, well, actually, no, I'm not. Sort of changing a little bit how we ask these questions, and asking really simple and open questions like, how are we? What concerns do we have today? So knowing when to use open and closed questions is really important. That, you know, the difference between creating psychological safety versus asking questions that need to extract clear information. So being able to flex and knowing when to use what is probably a core skill. Not, and what questions you ask are probably the things that you're going to need to change, and we invite teams to change depending where they work and how they want to use it. So this kind of gives you a bit of a flavour of what a check-in could look like and what it did look like for us when we were using it. And then the second step is called a peer-to-peer pit stop. And pit stop was a deliberate phrase used so that we could think about, if you think about racing drivers, they have a pit stop to change their wheels, to refuel, to do all of those things. And that's kind of like the essence of, for teams to have a peer-to-peer pit stop. They're going to be brief. You may need them, you may not need them. It really, really depends. And I'll give you some examples of where this was used. And a bit of a structure here that the psychology team developed to enable that. Not just to say, it might not be necessary for teams to always do this. It might be triggered by a particular event or situation, or some teams may choose to do this just as a sort of a brief sort of touch point in a working day. And then the last step is checking out, so the ending well. And I've seen various versions of this, great examples of in hospitals where they've sort of had a checklist on changing room doors, you know, of sort of encouraging people to end well. And that's what these questions, what the checkout opportunity is, and it is just asking, is there anything that we need to hand over, celebrating and acknowledging what went well, what we're proud of. This was particularly important in COVID times, and actually just as important today, acknowledging what has actually gone well in a day can be really, really helpful, because sometimes I think we go home worrying about the things that we haven't done, and things that didn't go well. So, but in and amongst that, things have gone well, and really drawing that out and making a deliberate effort to focus on that can actually be really sort of important and influential. What have we learned today that will help us tomorrow? I think that's a really nice question. And also just checking in with colleagues. So checking in, I suppose the intention here with checking out is checking out together as a team, checking out individually, and also checking out with colleagues who might not be sort of there in that moment. Is there anything, you know, we need to do or follow up? How do we include people that might not be here today, but we want to, you know, inform them of something that's important the next day? So really thinking about everybody and on all the dynamics that we have within teams. But again, you know, this can be adapted to whatever it is that teams need. And the good thing about having something out there is that you can then adapt and adopt, you know, as required. So those are the sort of 3 steps that of Start Well, End Well, as we sort of have them and share. And we do share an editable version of this for people to make their own. You know, I've talked quite a lot about why it was important during COVID that that this was evolved and developed. But it's just as relevant today, and arguably even more relevant. I think the busyness, the complexity, the uncertainty is the same. It might be for different reasons, but we have pretty much that. A lot has changed, is probably the cleanest way to say it. And why it is just as relevant today, and probably is the core of the joy of work in work special interest group, is that we need to think about our workforce. We need to think about the long-term sustainability of our workforce in the healthcare system. And you know, the NHS last year launched the first long-term plan for the work for our NHS workforce. And I think interventions like Start Well, End Well really speak to the retain aspect of these policies, of what are we going to do to help support and keep our staff in the NHS, because we are losing a lot of people, and what are we going to do to make them feel included, to enable that sense of purpose and that belonging. So there's probably other versions of Start Well, End Well, or other interventions that have the same purpose, but this is one way that I think really speaks to our sort of future within the NHS. So to me, it's just as relevant as it was in 2020. And also, you know, as I said before, these aren't just nice things to do when we're having a really good day and the sun is shining and everything's going as planned. It's important all the time, and the evidence is evolving constantly. And you know, people like Michael West and others as well are really showing the link between that the quality of team working directly impacts the quality of the care that we deliver, patient satisfaction and staff well-being. So, you know, it's really, really fundamental to how we do our jobs, and our service users as well. So it's definitely not fluffy, and the evidence there, I think we need to be drawing upon that evidence all the time to demonstrate the value of all of this. And I've said already quite a few times that this is to be adapted. This isn't a lift off the shelf and use exactly as it is. And a bit like hydrangeas, they change colour depending on the pH value of the soil. The colour of your Start Well End Well will really change depending on your context. You know, you may be part of a team that works entirely hybrid. So how will you use and adapt Start Well End Well for that? You may be a non-clinical team and you have different challenges. You could be spread across the UK, might not necessarily even be in the same city, but you're working together. So it's really down to teams to adapt it and use it as you know, as they need to, as you need to, and as you want to. And as I said, so if you did want a copy of Start Well End Well, and if you did want the implementation guide that goes with it, this is the email to use to sort of request that copy. We've got an editable version of it. We've got a Creative Commons license, so we're really happy for teams within healthcare and other public sector organisations to use it and to adapt as they wish. And we would love to hear as well how you are using it, because that then just adds to the knowledge base. So just to give a couple of real examples of how it was used. So this was actually during COVID. We set up, our organisation had a vaccination hub. First that was within our organisation, and then it moved out into the community. And Start Well End Well, as I showed it to you with the A, B, C, D, E, F, worked really well actually in that vaccination context, because things were changing constantly. The safety aspect was really, really high in terms of giving vaccinations, you know. So it was used pretty much as I presented it to you. And the vaccination team actually did use the pit stops a few times. It was necessary with new information that was coming in, because that I'm sure I don't need to remind you, because that was constant. The goalposts were changing constantly, so pit stops were important. And also within that context, because we had people volunteering to give the vaccinations, it was just, you know, some of the aspects that I spoke to you before about people not knowing each other. You know, the shape of the team was changing constantly, sort of not even daily, probably hourly, as people were coming in and out. So Start Well End Well worked really, really well in that environment. Also, during COVID, our respiratory physiotherapists used it. They were a much smaller team. They already had some natural touch points in how they worked anyway. They didn't use the pit stop so much because they often gathered together for lunch. But what was new is the ending well. So I had the privilege of joining them during their time of checking out together. So that was a new behaviour that they developed during COVID, and I think what they really valued in checking out was making sure that they, I guess, left work with a bit of closure and thinking about what they were going to do when they got home. That was sort of self-compassion focused, sort of really helped them to end the day well. And then sort of the few years after that, after sort of as we moved into 2021, 2022, some of our outpatient teams wanted to add Start Well End Well in how they worked. So they did it using notice boards. And I know this picture isn't sort of great, you're probably looking at it thinking, oh, what a mess, but it was just an example to say that they really made it their own. So they didn't necessarily use a template as we did, and then sort of have it in front of them, but they designed their notice boards in sort of like their core area of where they worked, and asked questions like, what are the issues from yesterday that we need to hand over? you know, the picture on the left shows that quote, joke, or riddle of the week. So they also had fun with it, because this, you know, it wasn't just all serious stuff. Some of that lighter stuff was really important. You know, they were clearly, when we took this photo, celebrating that it was payday as well. So they really made it their own. And what was really great to observe with this team is that they changed who facilitated the sort of starting well aspect of it. It wasn't always the person in charge. They really had a go at, I guess, at that shared responsibility aspect and that distributed leadership. And that was great to see. Yeah, and it just added something different, I think, to the dynamics when teams sort of felt supported to do that. So earlier on in the introduction, Julia mentioned about Q Exchange and funding that they give to projects. And so in 2021, 2022, we applied for Q Exchange funding to help us evaluate Start Well, End Well. And that was really helpful. And part of the evaluation, we I guess the purpose of our evaluation was to understand, you know, what is it contributing to, and it goes back to, I think, some of what we thought, that it really strengthened the well-being aspect within teams by actually, I guess, explicitly making a point of talking about it. So the compassion aspect, you know, what are we going to do to keep well? What are you going to do to keep well when you go home? It really just sort of strengthened that, and that welcoming aspect of it, of saying, you know, how are you? So constantly checking in together about, you know, those aspects. So simple, but really, really impactful. It helped with the sort of that continuous element of service and care, of handing over. That communication is a real challenge with teams changing constantly, you know, with the types of shifts that we work. So being able to hand over important aspects, bits of information from one day to the next, it sort of really allowed for that. And also it really gave some teams the power to escalate things up as well, rather than feeling, oh, this is annoying, this isn't working, and then going home and coming back the next day facing the same challenges. It, by discussing it in from a team level in this way, it enabled them to sort of think, actually, all of us, or a few of us, have said this now. There's a bit of a theme. What do we now need to do next in terms of escalating it up? So it really sort of helped and empowered people to do that. So I'm just moving some things so I can see the rest of the screen. So I guess in some ways, just moving to the top right, it helped teams to move from reactive to proactive. And that's a rarity in healthcare. I know how reactive we all are, so it enabled some of that. And it just contributed towards working together. You know, when I was a radiographer, I know the difference between feeling like you're working on your own versus at times the feeling that you're part of a team, and how important that is. And I think we're constantly switching from that dynamic, but making a conscious effort to feel that we're part of a team and not on our own is really, really important. I think when I was a radiographer and worked as a radiographer, so that was from 2000 to 2015, times are very different to now. And I think I would really value something like Start Well, End Well, to feel like I'm part of a team and not just working on my own. So those were the things that we came out. Just to say, Start Well, End Well, it's a really hard thing to evaluate. And we really started to understand actually what was important to Start Well, End Well if we were going to invite teams and encourage teams to adapt it. And so it really, I think, has been on my mind and continues to be on my mind, because I don't think we've fully understood this yet. But what is core to Start Well, End Well? And so I'm really much asking that question as an improvement practitioner and somebody who's really passionate about adoption and spread in healthcare, is what is important to what is core to Start Well, End Well, if we're asking people to adapt it to their contexts. And I think for me, it is these three things. It's really understanding what team psychological safety is and how we enable that, really understand what compassion is and what that looks like. And I think it's the skills of a coach, those coaching skills and leaderships that enable that. And I'm just going to spend a bit of time talking a little bit more about those three things before we move into questions. So you all know that Amy Edmondson has coined the term team psychological safety. Just to say that psychological safety originally comes from education. So Carl Rogers in 1954 really thought about this from an educational point of view of what psychological safety is. Amy Edmondson has done a brilliant job of coining the team aspect of it and actually bringing it into healthcare through a lot of her research. And this is what team psychological safety means, believing that we won't be punished or humiliated for speaking up, asking questions, raising concerns, and making mistakes. This is almost easy to say, but really hard to experience and feel. And we can't just say, oh, we're a psychological safe team, or we've got a psychologically safe culture and environment. We can't tell people that. It's people's experiences, and those experiences are going to be from our behaviors. How do we interact? How are we turning up each day? How are we conversing and communicating and being with each other? So they're the social components, I think, of how we are, and that is really hard. It's really hard to it's something I guess teams have to learn to be together, and it's about behaviors rather than any specific questions, or it's not about a checklist that if you ask these 5 questions then you're going to be psychologically safe, or you're going to have a psychologically safe environment. It's very much an experience of working in that environment. So that's why that regular feedback, reviewing, all of those things is really important, because I think it's something a team and a culture figures out together. So that's, a really, really important aspect of that, and an understanding of that. Then there's this aspect of compassion, and the NHS is founded on being compassionate. Sometimes, and this is my opinion, we stray into being altruistic, probably quite a lot. I think a lot of us, if you put our hands up, we've probably been very altruistic. But compassion is more than giving. We're very good givers, but how good are we at receiving compassion from others? And how good are we at self-compassion? And Michael West here says quite clearly that a culture of supportive teams with compassionate team leadership is linked to reduced levels of all, like, stress, errors, staff injuries, absenteeism, and patient mortality. The evidence is also out there that the more compassionate we are with ourselves, the more we are able to be compassionate to others. And that might sound really counterintuitive. It isn't what we do. We put others first before us. I really loved a slide that Julia shared on LinkedIn about a month or so ago. Putting me first isn't selfish, but that I don't know, I think we're hardwired to think that if we put ourselves first that it is selfish, but the evidence, thank goodness we've got evidence that's coming out there, tells us otherwise. So I think practicing all flows of compassion, if I was to ask you, how good are you at receiving compassion? I'm going to put my hand up, not good. Much rather give it out than to receive it, but it makes a huge difference. So all aspects of compassion are important. And then lastly, another thing that's important, you're probably thinking, of course you're going to say this, you said you're a coach, but the more I think about this and the more I learn about the skills of a coach just by practicing coaching myself, the more I really believe that the behaviors that of listening, of being present, of observing, of asking open questions and really actually being curious, I think, of what the responses might be, because we can ask open questions with an answer in mind, but we can also ask open questions and be genuinely curious as to what comes back. So when we ask, how are we today, you know, asking it and really letting that question land could be the difference between people just saying, oh yeah, we're fine, to actually I feel safe to say that I'm not okay. So practicing those skills is just that, it's practice. It's actually the opposite to probably why we come to healthcare. We get into healthcare because we want to problem solve, we want to help. And sometimes that can be counterintuitive then to using coaching skills, because we probably have to slow down a little bit, and be curious and maybe not rescue so much. But those kind of skills really invite, I think, some of the core principles of psychological safety, and compassion that Start Well End Well has from sort of start to finish. So that is probably leading me to come to a summary, and to summarize and actually have plenty of time for any questions and discussions that we might have. Is that I hope, in the last sort of 40 minutes, I've been able to explain to you what Start Well End Well is, how it came about, but equally and more importantly, why it's still important today, and also what is core to Start Well End Well. I think I've shared my opinion of what's core to it. I think there's more to learn about what is core to it as well, and I hope that conversation continues. I also said early on that you're welcome to have a copy of our editable version. Somebody's adding some artwork to my slide, thank you. So please use this email address if you'd like to hear more. Actually, happy to even share our evaluation report from Q, which is also on the Q website, but more than happy to share that version of the PDF version of it, so you can have a read. But we have an editable version of Start Well End Well, and an implementation sort of guide just to sort of help you with it. So more than happy to share that with you if you just use that email address. So that is all from me. I'm going to stop sharing so that I can actually see some faces, and yeah, and see if any questions have come up, or if anybody would like to ask some questions, or even just share any reflections.
That was brilliant. So thank you so much for sharing that. It was really insightful, and I've seen a much shorter version of the presentation, so it was great to gain an understanding of more of that, so thank you. We do have some questions in the chat. So the first one talks about, well, actually, Lynn, she says, Lynn Flanagan, can you say more about what methods you use to evaluate the initiative? And then I've got some emojis. Did you notice any impact on outcomes for staff, like staff absences, etc.? And Matthew talks about Q after that, so I might bring Matthew in as well after you've answered that.
Yeah, lovely. Really good question, Lynn. We really we were really ambitious actually with how we thought we were going to be able to evaluate Start Well End Well, and we kind of really had to scale it back. So what we did in the end, I think it was valuable, but I think we really only scratched the surface really, is that we decided to use a lot of observational studies. So we observed teams when invited who of how they were using Start Well End Well, and then did a thematic analysis to sort of collate those themes that I showed on the slide. We wanted to link it to things like staff absence, well-being. We did use a well-being, there is a validated well-being tool, but I don't think we use that consistently with teams to draw any meaningful data. And we really struggled of linking it to sort of staff absences and other staff data at that time. I think if we continued evaluating it, that kind of data would be really helpful. So we had an aspiration to do that, but the reality didn't allow us to. So I hope that answers your question, Lynn, as to what we did and what we would have liked to have done.
Matthew, you've put in the chat some information about measuring psychological safety. Do you want to say a little bit more about that?
Yeah, I suppose I was just wondering if you considered, using a psychological safety measure. I think, doesn't Amy have one with 10 questions? But you can even just ask one question and
Yeah.
and also I know there's something else I mentioned in that comment. I know various Qs use a kind of assessment thing called relational coordination that also has lots of interventions as well. But that kind of maybe gets at a lot of the stuff about the quality of connections around the team and sort of draws little maps of them. And I don't know whether that would be a useful thing for this and Schwartz rounds as well, to kind of track the changes and see the improvements. But yeah, did you think of doing kind of psychological safety assessment?
Yeah, we did. So the staff psychologists, as you can imagine, they like to, and this is a good quality, like to evaluate and really sort of get sort of thorough with the evaluation aspect of it. So we did. Forgive me, I'm going to forget the details, whether it was Amy Edmondson's or another psychological safety validated tool, and we did need to slim the questions down. But our challenge, I think, was at the time of evaluation was the consistency, and having long enough, because I think we were, and this isn't a criticism, but when you are given money to evaluate, you are limited by time. I think this requires a longer, or thinking about it now, longer time to evaluate, and that consistency of using those validated tools at regular times with teams as they're using it. And I think that was probably where we struggled. It was the time constraints, because it was stop, start of teams using it. Yes, we're interested, and then there was a bit of a pause. Then if we were doing a longer evaluation, definitely.
Thanks.
Yeah. But I've not heard of that relational coordination tool, so I'm going to have a look at that. Thank you. I hadn't come across that.
Right. So I have a question, actually. I don't know whether anybody else has. Oh, actually, we'll come in and bring Laura in.
Yeah, because I think I've just, thank you. That's a really good question. So do you use Startwell Endwell specifically with teams over a period of time, or for this evaluation, it was probably over shorter periods of time. The Startwell Endwell now firmly belongs with the staff psychology team. So they have continued to work with teams, not so much alongside them like we did when we were doing the evaluation and during the height of COVID. They kind of get the tool, get some training of how to use it, and then teams are sort of given the validated tools for themselves to evaluate it. But it's really, I think I suppose one of the things for us is the more we sort of give it and make it available for teams to use, we want to hear back actually from teams that have used it over a sustained period of time, so that it's kind of like adding to the growing pot of knowledge and isn't sort of led by us, if that makes sense. So I would be really interested to hear from teams that do use this over a longer period of time, to sort of to see the impact of it. Oh, Julie, you're on mute. Julie,
Oh,
you're
yes,
on
yes. Habit I seem to have. That's great. My question was just really about if someone has heard this for the first time today, is really keen on running with it and implementing it. Have you got any kind of top tips from your learning experience about how you would do that?
Yeah, that's a really, really good question. I think the first would be that if you're thinking about it, is to perhaps before sort of launching into it, is discuss that with a team. So it's a team decision. Do we want to give this a go? And start with, you don't have to start with all 3 steps and doing all of this all in one go. As with any habits, I think it's starting small, perhaps, and being consistent with that first sort of step. And I think the easiest, I think it's probably not a surprise. The easiest is the starting well aspect of it, because teams might naturally have a point where they navigate to together. So I'm just thinking of wards, for example. In our organisation, they have a safety briefing every morning. So they have an opportunity there, but perhaps their safety briefing doesn't ask how we're all doing. So it might be adding some of those things into existing practices, if that's possible. That would be sort of the advice. If you don't do any of that already, it would be then deciding actually which of the three, and actually it's probably going to be out of the first and the last step, which one shall we give a go, and maybe there's just a small part of it that we're going to give a go, see how we're doing, and then evolve it from there. But it's, if possible, if you're enthusiastic about it, is to perhaps share that enthusiasm with others, so that others feel enthusiastic about it as well, so that it's not all on you, and to kind of start giving it a go as a collective rather than one individual wanting to make a difference. There's a balance, but yeah, that would be my advice.
Yeah, I love that idea of just starting with one and then or part of one and then building it, because I think sometimes when we launch things, it can just feel, oh, this is all new and it's all a bit different. So that's a really nice approach to that. Does anyone have any other questions? Laura has put some information about how she's thinking of taking that forward in the chat. Vardeep, I don't know whether you've seen
I've
that,
seen
but
that.
that's lovely to see.
Yeah, and yeah, Laura, get in touch if you'd like a copy of this, or and also if there's anything you'd like to say now, you're more than welcome to come off mute, Laura, and say a couple of things. But that's great.
So
Yeah,
here's
have
another
you had any?
question.
Yeah, board level yeah. We have presented it back to the board. We have shared it. We've had a lot of change at our board level in our organisation, and we have, a bit like Schwartz Rounds, really, raise it, talk about it. I'm going to be honest, I know this is being recorded. We've struggled with that buy-in, because I think goes back to the data, doesn't it? The cause and effect. What is the impact of Start Well End Well? What is the impact of Schwartz Rounds? And I think if it's not a hard return on investment, or we've improved staff sickness by it's really hard to sort of, for I don't want to be critical of people at board level, but it's really hard for them to engage. So our motto is to keep that door and conversation open, share about that we're doing this, share about that. Actually, a lot of people external to our organisation have been interested in Start Well End Well, and just continue that. And if you can and do have somebody very senior in your organisation that can support and champion this, get them on board. It is helpful, but also don't let that stop you either. That might be a bit cheeky, but just if you believe it's the right thing to do it. And I do. Yeah. So I was just going to say,
Vardeep, carry on.
Yeah, so no, just part of Hannah's question there is that about barriers, and that's why, if there is that just anybody that is kind of can champion this, then do use them. But I can resonate with that, with what you're saying about, we've never had any barriers of it being used, but sometimes we've been a bit like, oh, wouldn't it be great if this was just promoted more at a senior level within our organisation? I think we probably wish that we had that. Sorry, Julia, you were going to say something.
No, I was just wondering who, just generally, it'd be interesting to get people's views about if anyone was looking at implementing this or has implemented something along a similar vein type thing. Who you would go to at board level. And I was wondering, do all trusts have a director of people? Because there might be people to tap into. So there might be somebody who lends themselves to having those discussions with at board level. It was just to mention that.
Mm.
Yep, Sarah said, I'm a speech and language therapist who really champions wellbeing within the workplace in my work setting, and I'm looking forward to putting this initiative to my team and promoting it. That's brilliant. I definitely think you've shown a real nice framework today from which people can take and work with, and it's great that you can adapt it and change it and make it your own, which is brilliant. Now, I am aware we've got a couple of minutes left, so do we have any further questions for Hannah? If you do, could you just pop your hand up? Right, I think people are wanting to get the lunch if they haven't had it already. So I would just like to say a huge thank you. That was really insightful. I've really enjoyed the hour. I thought we would have a fantastic hour. So thank you, Vardeep, for taking the time out to do this. And thank you for everybody who's joined the call today. And if, do contact Vardeep, she's very open to that. And, do tap into those resources. They're already there. Brilliant. Thanks ever so much, Vardeep.